Hello. Thank you so much for joining me today. I'm excited because we're going to find out today who has the #1 healthcare system in the world. Let's go. America, we're #1. We're #1. Wait, best healthcare system, not most healthcare bankruptcies. Okay, never mind. I don't know who that is. I think someone in a comment told me it was France. So that's what I'm going to go with. That's my bet. Regardless, I'm guessing it's not America. I'm really interested to watch this. It's by a small and up-and-coming YouTube channel called The Washington Post. Go check them out. Link down below.
I want to start with a simple question. Which country in the world has the best healthcare system?
That's not a simple question. And now that he asked it, now that I heard it out loud, I'm thinking maybe Japan. I've heard theirs is really good too.
Yeah. So I hate that question. Here's where you should ask me why I hate that question.
I knew you were going to start with that question.
I think it's a question that a lot of people ask. Which country has the best health?
There's a lot of different metrics you could go by for that question, huh?
I don't think there's a correct answer to it.
It depends on what it is that we value.
Like if you're going for lip injections, maybe it's America.
I'll give you an answer, but then I'll tell you why the answer might not be applicable. If you look at the World Health Rankings, the country that came out on top is France.
Where was America? I didn't even see America on that list. France. Hey, I said that.
I think
thanks to that commenter.
In general, starting from France and working northern, you tend to get the best healthcare systems. But the reason why it's not entirely applicable is that
something about the cold weather, huh? Actually, it's not even that cold in those countries.
What works in one country may not work in another country.
So a number of years ago, just a few years ago.
Right, because here in America, we need a lot more diabetes treatments. It's a little different.
I wrote a piece in the New York Times with my colleague Aaron Carroll. We actually did a tournament of health systems. It was like a bracket tournament, the way March Madness is a bracket tournament.
Like that.
A tennis tournament.
Very nerdy.
And we had me and Aaron, Uwe Reinhardt, Ashish Jha, physician, now Dean of Brown, and Craig Garthwaite, an economist at Northwestern. And we each voted in each of the brackets, like in each of the pairings, for which system we liked better. And then we ultimately got a winner. But one of the important
Switzerland?
takeaways from that whole
I could see
process
that. I mean, their
in
flag.
no pairing,
Sorry, sir. I interrupted him and I almost got angry at him because I couldn't pause the video. I'm sorry, sir. I interrupted you. But anyway, their flag is literally it looks like a med kit in Fortnite or a video game. You know what I mean? It's like a health symbol.
one of the important takeaways from that whole process is that in no pairing did any country win 5-0. There were 5 of us, right? We were not unanimous in any decision. There was always at least someone who disagreed, and in many cases it was 3-2. And we each had different reasons. You know, someone was very big on the cost, equity, access, or the quality. And so to me, look, this is...
Those are pretty important. And I think they quite well illustrate why America's not #1.
5 people who know healthcare pretty well and know these systems pretty well, and we couldn't even agree. So there's just no clear winner, actually.
But the one thing that stands out is that among all major developed nations, it's pretty clear that the United States comes in dead last.
I don't know. I didn't expect him to say dead last, like that matter of fact. Damn.
On the other hand,
That
I think
sucks.
everyone, especially experts, should be skeptical that they know the answer.
But you know the thing about America? It's crazy how we're dead last, and I believe that, but it's really pretty much mainly because of the cost. Like the actual system is fine as far as the treatment, the quality, the speed. It's the cost. Nobody can afford it. Now that's why the speed is good. Nobody can afford it.
Because what works in
There's not that many people in line.
one
Actually, honestly, there are still a lot of people in line. They're in the bankruptcy line the next day.
country or one setting doesn't necessarily work in another.
So, there
Sorry, guys. I'm kind of going off. I've had to pay one too many healthcare bills this year. everybody in my family has been sick. And it's absurd. It's ridiculous. I mean, I'm sick right now. I have bronchitis. Have I gone to the doctor? No. I didn't feel like paying $80.
Aspects of the Australian system I like. There are aspects of the English system I like. But I don't think that there's a system we could just bring over here and install, like a new fridge.
So maybe the better question is, what would the best system for the US look like?
And what
There's something funny about that because I haven't been thinking about this video from an American standpoint at all. There was nothing to say this was an American standpoint. Now, of course, Washington Post is an American paper, so I guess fair enough. But when she said that, it just sounded so, like, arrogant. I mean, really, the only important thing is what would be best for the U.S. Who cares about what the best system is in the world? That's irrelevant. Who cares? We're only concerned about the U.S.
would that look like?
So a good healthcare system, or let's just call it a healthcare system. A good healthcare system has, I think, to me, several attributes.
Okay.
One is,
How does it affect our health as a country?
How long is it that people are living? What is the infant mortality rate? What is the rate of certain types of diseases, and how well are they doing in prevention?
And the second question I'd want to know the answer to is, were the benefits of the treatment
Measuring prevention. Sorry, I had to say this because I got sidetracked. That's what I'm thinking. I'm just thinking, how do you measure prevention? That's kind of a hard one.
greater than the cost of the treatment?
A bad healthcare system could have overspending on care that's of really questionable health benefit at the same time that it has underspending on healthcare that's of vital importance to people. So when people say, do we spend too much on healthcare? We spend way too much on some things and way too little on others. So a good system would fix both problems.
And the third dimension for healthcare system is
The people spend way too much on everything here in America. The infrastructure and system spends too little on some things, I think is what she was saying.
how well does it reflect our values as a society?
And by values, I mean, what are the rich willing to do for the poor? What are the healthy willing to do for the sick? The answer to that doesn't come from economics. It's an answer that we all have within us.
Kind of the funny thing is, though, here in America, kind of ironically, it is a pretty charitable country. Like literally as far as charity fundings go and stuff. Obviously we also have some of the most rich. I'm trying to think of a nice word. A word that, we have some real assholes, rich assholes. But America's culture isn't entirely just let's just forget about all these sick people. That's not how the actual populace, that is a lot of how the politics works, but it's not so much how the culture actually is. There's kind of a disconnect there, at least among some people.
But that answer profoundly affects how you answer questions about what's good and bad
point.
about healthcare.
And I would hope that going forward, as we think about the learnings from other countries, we can take a hard look at what it is that we have and whether they align with our core principles that we otherwise hold so dear.
I actually think, that gets to a really interesting point. I'm thinking more about how I said there's kind of a disconnect. And I think that there needs to be more education in America. People need to be sat down and think a little bit harder about the implications of our system. And, is it really, or do you actually support a system where someone, a family, a mom, a dad, a child, children get more funding. There's hospitals and stuff, like the Ronald McDonald House and stuff like this, where kids can go if they're sick, thank God. But adults, a mom, a dad, and kids still. Should a family be bankrupt? Or should a family hesitate to go to the hospital for for care that they need because they're concerned about their finances. And whether it's directly about the kids or indirectly, if you might, as a parent, you might not get a surgery or not go to the hospital because you need to put food on your kid's plate that night. So it both directly and indirectly does end up affecting everyone, including the most vulnerable people in the society. The fact that the healthcare is so expensive. And I think that most Americans, if you sat them down and honestly showed them, talked about it in a mature way, instead of how politics is, where they just bitch at each other on stage and try to say clickbaity talking points. I think there would be more support for universal health care.
So my goal is have a health system that does the most it can to improve our health, that protects people from financial ruin, and that conforms to our values as a society.
So yeah, that would be the right thing to do in principle. That the next question should be can we get there from here? And I just don't see it.
What we've seen over time is that the costs of healthcare have gone up, but outcomes have also improved. So if we take some measure, and the measure that I like to use is life expectancy at age 40, and then I look on the other axis at the cost of healthcare per person. And what you find is, if you look back to 1976,
All of these countries, the US, Germany, Canada, look similar in terms of what share of GDP goes to healthcare.
and they are all living, people are living about 35 years after age 40. Okay.
Fast forward 20 years, and the US is spending a lot more of its GDP on healthcare, and its life expectancy increases have not.
I can't help but mention that there's a little bit of a disconnect between, GDP is not GDP per capita. This graph is about per capita, which makes more sense than just talking about GDP. Anyway, sorry. So let's see. Okay, this is super interesting, though. Okay, we're going over time. All the countries are relatively clustered together. I mean, if you look close, it's kind of misleading because, honestly, America is still spending double what, England is, or Britain, and Japan. Probably triple Japan. So it looks a little better than it is, but okay. And look at the life expectancy. Man, Japan is killing it over here. Low cost, highest life expectancy. And not just low cost, lowest cost. Wow.
And the US is spending a lot more of its GDP on healthcare, and its life expectancy increases have not kept up with the life expectancy increases in other countries.
So
That's honestly an infuriating visualization right there. It's kind of infuriating, you know what I mean? And honestly, even back when they started it, because you know how I was saying, if you look close, the US, we were spending double the other countries. Well, that's still where we're at. It's double. It's just more obvious because we're on a larger scale, higher up the scale. So you can see how spread apart it is. But down here, we were spending 2K and they were spending 1K. That's double. Now they're spending 3.5K. We're spending 7K. But you could really start to see it accelerate upward in cost there at the end, which is just pathetic.
Increases have not.
You're trying to go to the right on this chart. You know what I mean? You're trying to go to the right and stay low. We're almost just going straight up
with the
here.
life expectancy increases in other countries.
So the US becomes increasingly an outlier, both in terms of outcomes, that is life expectancy, and in terms of spending.
Now, you can put the two on the same graph, but that doesn't mean that they're related in any way.
Oh, and I guess I should clarify something. Earlier, I said that the U.S. healthcare system is pretty good, apart from the cost. Well, the cost influences all the other metrics too. So our life expectancy is bad because, in my opinion, because, in large part, it's because we eat a bunch of crap and we don't walk anywhere. But other metrics, infant mortality and stuff, are bad because people don't use the services. It's not that the services are bad, it's that they're too poor to use them or they can't afford to. It's not because the actual system, like services, are bad.
I think we're simplifying the other healthcare system to the point of getting it totally wrong. But a lot of it depends on who you're talking to, right? I think there's a view that some Americans have that in other systems care is terrible. You know, there's very long waiting lines and waiting lists.
Now, he says that kind of dismissively, but of course, I know from reacting to different content and learning about all sorts of different systems, in some healthcare systems, the wait lines are very long. You know, it's not like it's not like a utopian world where everything's just perfect everywhere in the world. I still think it's better than the alternative here in America, where you purposely just make it so people can't afford it. And so, yeah, the lines are shorter, but it is true that, you know, wait times can be an issue in a universal healthcare system. Let's not pretend it can't.
That the latest medical technologies are routinely not available. I think for a lot of other Americans, there's this view
But that's just something you need to overcome.
that other countries have just figured it out. And what we should be doing in the United States is copying what they've already figured out. And I think both those views are not right at all.
So I think people mix up this term called socialized medicine with what I would call universal health care.
One is the insurance part, that is who runs the insurance, and you can have socialized insurance where the government is running the insurance, or
Yeah,
private insurance.
that would be the easiest and quickest way to do it, I feel like, here in America.
Private companies, or both. And then second, there's the providers of medical care, who could be either government-run employees or private employees.
There are some methods that one could classify as being socialized medicine, meaning that the government is a single payer, the government operates all the healthcare,
Right.
and people belong to a single government system.
Which honestly could be great, could be horrible. Completely depends on the government, which is kind of a scary thought.
So Britain has socialized medicine because the hospitals are government institutions and the physicians and nurses are government employees.
Right.
And France has yet a different
If you have a great government and they do a great job, then it's great.
kind of a system, also not government owned. In Switzerland, Netherlands, Germany, these are places that have universal health insurance, but they have active and important private health insurance companies that administer it. So very different structures of these systems. The thing that they share in common is that they're universal.
So I think
Yeah.
coming full circle, my great worry with healthcare reform in America is that it has collapsed to the level of kind of fighting and arguing about these slogans. And the slogans have nothing real behind them.
These slogans have become so politically charged and tied to a particular candidate or a particular viewpoint.
I agree.
That has become completely partisan and will shut down.
And the entire fundamental issue, like who we are as people and as society and what we're trying to do, it just gets lost, I feel like. It just gets lost, which in this case means a young man with cancer gets lost. It's not about him. It's about the stupid politicians, blah, 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 stupid talking points.
Constructive debate.
And if you go back to what I was talking about, how do you evaluate a good healthcare system? You don't evaluate it by the share of government in the system. You evaluate it by whether patients want the care that they get and whether the care that patients get is worth it. I think that other countries have great hospitals, cover a lot of medical treatments, have fantastic doctors, and at the same time, they have not figured out a bunch of things that we have not figured out. So if you are the kind of person who's going without health insurance in the United States,
I hate to say it, but I think
I was that type of person for a long time. Luckily, it worked out. I saved a bunch of money and just didn't go to the doctor because I was young and healthy. But it was sure a gamble.
we are better off in many other countries than here in the US.
But for a lot of diseases, for a lot of people, regardless of income, this is probably the country where you would like to get your health care.
Wow. That video got me a little too worked up, folks. Or maybe not worked up enough. I don't know. Ooh, it definitely has been on my mind a lot lately. Something's got to be done. So, did we answer the question, who has the best healthcare? I guess France. I don't know. Japan and France, honestly, were looking pretty good on that chart. Definitely not America. Thanks for watching. I hope you guys are doing good. Have a great weekend. I'll see you next week.